Good afternoon and welcome to our daily media briefing. As we saw yesterday, we are making progress in reopening our society bit by bit. I know you can't see this when you tune in each day, but behind the scenes, there's a lot of people working to get our county back up and running. So today I'm encouraged to announce that the county will begin a safe reopening of its county offices this Friday, May 15th, and it will continue gradually over the next several weeks with modified services. As we reopen, we will follow certain criteria, including the implementation of sanitation protocols at all work sites, ensuring required protective equipment for applicable employees, initiating temperature symptom screenings at county facilities, and modifying work sites to ensure social distancing. These are steps we've asked permitted businesses to follow for their reopening, and we are taking those same measures too. Some of the departments that will reopen include Child Support Services, which will open offices in Kearney Mesa, and then we will phase in soon thereafter the offices in Escondido and National City for public access, and the Kearney Mesa facility will again be starting on Monday, May 18th. They'll be open from 8 a.m. to 12 noon, Monday through Friday, to assist customers in case opening, case management, and to assist in accepting kiosk payments. Further openings will be coordinated with the courts. Our Department of Environmental Health will begin in-person counter service by appointment this Friday. Field food inspections will increase as well due to additional business openings. Now I want to emphasize that many in our county workforce have been teleworking for the past few weeks, and essential services like our Sheriff's Department has continued to function in a regular manner. The opening of some offices to the public is an important step in our recovery, and we are looking forward to that. I urge everyone to make sure you call ahead of time if you plan to visit a department, and check our county website at sandiegocounty.gov for more updates. Employees will be notified by their supervisors on the specific date upon which they should report to the work site. Until such notifications, they will remain on telework status. I want to thank our dedicated county employees for adjusting their daily routines while maintaining commitment to serving the public. The state's stay-at-home order has given us opportunities to redefine how we serve our community going forward, and our employees have shown how flexible, creative, and dedicated they can be. With that, let's move straight to the updates, and I'll call on Supervisor Fletcher.
Thank you, and good afternoon. As Chairman Cox alluded to, we continue to move through our reopening in phases, and it is important to note that thus far, as a region, we are doing a good job. We are doing it the right way, cautiously, slowly, in a methodical approach, and thus far, we are on a pathway to continue our reopening. From the very beginning, we said it was important that we wanted to have a forward trajectory and forward movement. I think it's important to note that when a posture changes or when things begin to open up, we will not immediately know the impact of that change. It takes a while as behaviors change to know, are we seeing an uptick or not in the cases. It takes a while for there to be spread, a little bit longer for community spread, a little bit longer for symptoms to develop where individuals get tested, and a little bit longer for those individuals to go to the hospital, which is why we are working through this in phases, because we do believe it is more important that we continue consistent trajectory of opening in a safe and responsible way than to go too fast, too far, and be in a situation where we have to clamp back down or move down. And so as we continue to go through these areas, we want to continue to do it in the right way, taking a step, monitoring the data, seeing what's happening while we continue to build up our testing, tracing, and treatment options, while we continue to monitor the situation in our hospitals, and we continue to all have an opportunity to adapt to the way that we are doing things. It's also important to note that not every community is impacted the same, and we have to be mindful of the reality that some communities are facing greater impacts and greater circumstances and situations, and they may feel a little bit differently, and so we are trying to move forward as one region as best we can. It's also important to note that the vital importance of the adaptations that we're asking people to make. We talked about April being a month of action where we significantly flattened the curve, May being a month of adaptation. With the operating assumption is that as we begin to loosen some of these, we can do it in a way that doesn't compromise the integrity of our healthcare system because we're changing the way we go about things. And I think it's important to note that each of these changes that we do and each of these adaptations that we make all really go together, and they serve a purpose to lower the risk. They don't completely remove the risk, but they lower the risk. Things like rigorous hand washing, something that we probably all were a little bit better at 2 months ago, are something that are a really important piece of what we're doing. I recently saw a study focused on military boot camps that showed that rigorous hand washing 5 times a day lowered medical visits for respiratory infections by 45%. That lowers the risk but doesn't eliminate it. Physical distancing. We know that that is important, especially when you have a virus that is primarily transmitted via droplet transmission. Being physically distant of at least 6 feet from non-household members does not eliminate the risk that you may get it, but it significantly lowers it. We know that temperature checks, like we do here at the Emergency Operations Center for everyone coming in every single day, and like so many of our businesses are putting in place for their employees, temperature checks help you identify folks who may not know that they have a fever, but it identifies it clearly. They can be put in quarantine, they can get a test, we can see if they're positive. That is another thing that helps. And then face coverings. We've shared the science, we've shared the data, we've shared the studies. We know that face coverings help as well. None of these things by themselves eliminate the risk, but together, if we do all 4, the kind of 4 pillars of what we need to do as we move forward, adhering to hygiene, physical distancing, temperature checks and screenings, and face coverings, collectively those things significantly lower the risk of transmission and spread. And so as we move forward in a phased, methodical approach, as we see widespread adherence to this, we do believe that we can get out of this in a way that allows us to get most sections of our economy back up and running, a lot of our way of life back up in a way while we wait for that vaccine or therapeutic treatment to take those final steps. And so we really encourage everyone out there to really adapt to these types of things, because it not only protects you, it protects each other, but it also allows us to continue the progress and trajectory that we're making. In that same vein of progress, I'm happy to share that we continue to see advancement and progress in our T3 efforts, areas around testing, tracing, and treatment. Our testing numbers jumped back up again, which we expected kind of middle of the week after we got through the weekend. We're seeing success in beginning to move our numbers of contact tracers. It's important to note that as the testing increases, the tracing will increase. And so as those 2 move, we hope that they both move up together. And we're also working very hard in our tracing component to ensure that that workforce matches the diversity of our community. It's vitally important that we have contact tracers that are culturally competent, that speak the right languages, that have the right trust, that have the right understanding of the communities they serve. I represent one of the most diverse communities in our county, and I know how important this is, and I know that our public health department is guiding towards building out this workforce in a way that will appropriately and properly serve with trusted messengers all the various aspects of our community, and so we will continue to work through those. Even though school is out, we still have seniors who are graduating, and we've received a number of questions about end-of-the-year graduations, in particular the issue of drive-through or drive-up graduations. The governor has provided guidance on drive-through ceremonies or drive-through events, whether they be church services or protests or graduation-type events, that those are allowable provided they follow the local public health guidance. And so today I want to share with you some of the guidance that our public health officer has issued, particularly for schools, but it applies to any type of drive-up event. Those are allowable and can proceed provided there's no exiting of the vehicle, there's no opening of snack bars, bookstores, or any type of concession stand. There's no opening of restrooms. There are no spectators, and only members of the same household may be in the vehicle together. Dr. Wooten, our public health team, has been in contact with school districts surrounding some of those individual things they would like to do, and she has issued that guidance, and we wanted to take a moment and share it with everyone else as well. Update on testing at the Convention Center. To date, 1,409 tests have been administered at the Convention Center. 383 staff have been tested to date. 1,026 residents have been tested to date. The numbers remain unchanged as we're still pending the additional results, but we've had 1,104 negative tests, still only the 3 positive tests that we've previously reported. 283 tests are still pending results, waiting to see what they are, and 19 to date have been indeterminate, and those individuals will be retested. Now we'll jump into our update slides here. Today we're reporting 3,541 tests conducted. This bumps us up to around that 3,500 number out we were running last week. This is encouraging as we continue to work through all of the myriad of issues related to a sustained increase in testing. We're now over 88,000 total tests performed. We have 171 contact tracers. We have an additional number that are in the process of onboarding, and we will be updating this as we move forward. You can see investigations performed there, 6,432, along with the individuals who are presently in our public health motel rooms and the cumulative totals. Next, we were today reporting 117 positive tests for today's report. That is out of the 3,541 total tests performed. That is 3% positive rate. That is good news. That is encouraging. We're seeing our rolling 14-day average of percentage of total tests that are positive continuing to trend downward. We're now at a rolling average of 4.9%. That is a trajectory we would like to continue to see, particularly as we increase testing and increase testing more into lower probability positive folks. And so we want to continue to see that develop. Very little change in our hospitalizations. ICUs are down 2 from yesterday, holding steady there at 142. Total COVID-related hospitalizations are at 385. On the next slide, you can see that 385 at the bottom, that is COVID, plus the non-COVID hospitalizations that you see, and again, holding very steady. These are the signs that are encouraging, that allow us to continue to move forward as a region and continue to see forward progress. The last one here just has our cumulative numbers, both in terms of positives, estimated recoveries, our hospitalizations there, the doubling rate every 33 days, ICUs doubling rate every 34 days, along with the loss of life reflected. That concludes my section of the report. I'll turn it over to Dr. Wooten for the Public Health Officer's report.
Thank you, Supervisor Fletcher, and good afternoon, everyone, and thank you for attending today's briefing. The global, national, and state statistics today are based on data from the Johns Hopkins dashboard, and these data were obtained today at around noon. Globally, there are over 4.3 million positive cases, including almost 295,000 deaths. Nationwide, the United States is reporting almost 1.4 million positive cases, and this is 32% of the global number and includes over 83,000 deaths. Statewide, California is reporting over 71,000 positive cases, including 2,882 deaths, and today the County of San Diego is reporting 5,278 cases, which is 117 more cases than yesterday, as well as 194 deaths, which includes 5 new deaths reported since yesterday. Now, of the total 5,278 cases, the age range remains from 3 months to 101 years of age. 52% of all of the cases are between the ages of 20 and 49 years of age. We are still at 49% of the total number of cases being female and 51% being male. 1,019 or 19% of all of the cases have been hospitalized, and of that total, 316 or 6% of the total have been admitted to the ICU. So regarding deaths, yesterday we reported a total of 190 deaths. We have since identified 1 duplicate, decreasing that number to 189, and today, with our reporting of 5 new deaths, we have a total of 194 deaths. The 194 deaths represent approximately 4% of the total number of cases. Now, of the 5 additional deaths, the ages range from 56 to 97 years of age, and all of these individuals did have underlying medical conditions. Now, of all of the deaths, 43% were female, 57% were male. And regarding race and ethnicity, of all of the deaths, we have data for 91%, or 176 of the 194 total. And this means that we do not have race and ethnicity for 18 individuals. The numbers have not significantly changed from yesterday. Our sincerest sympathies and condolences go out to the individuals, the family and friends of those lost to COVID-19 reported today. And I want to remind the public that all of our information is on our website. Now, I also want to remind the public that had we not implemented the physical distancing, our stay-at-home orders locally, many thousands more individuals, including elderly, would have died from COVID-19. And as our state health officer, Dr. Sonia Angel, has stated, often when prevention is done well, it is hard for people to feel or see the tangible benefits of these efforts. So as a reminder, in regards to congregate and community settings, to date, there have been a cumulative total of 64 confirmed active outbreaks. Of these active outbreaks, we have 42 in congregate facilities, with a total number of congregate cases at 1,214, which includes 92 deaths, and 22 active outbreaks in community setting locations, which includes 241 cases and 5 deaths. I'd like to thank you to all San Diego residents who have cooperated with our local health officer order and continue to do so. We are less than 1 week now into stage 2, and yesterday the governor added a few additional statewide modifications, which helps to further open up San Diego County even more. It is possible that we may obtain a potential revision to current metrics related to hospital data and other metrics in the next few days from the state. So we are anxiously awaiting that. Currently, our local metrics are trending in the right direction, and we will continue to monitor these data to support further opening of our local businesses. So now please welcome to the podium our chairman, Supervisor Greg Cox.
Thank you, Dr. Wooten. We'll go straight to the calls. Again, make sure you identify yourself by name and outlet unless you're introduced by such information.
Bridget Naso with NBC7. Please state your question.
Good afternoon. My question is the status update. And I heard just a little bit of it there, probably from Dr. Wooten, but let me just, I'll ask the full question. With calls from people to reopen in some cities growing and some local leaders in the county writing a letter to Governor Newsom saying requirements for counties to move into the next phase of reopening are too stringent for a county of our size. And the governor saying he would consider letting some of the counties move forward if health officials concur. So where is San Diego County on that, specifically the health side?
Okay.
Or both sides, actually.
Dr. Wooten?
Thank you for that question. And I believe you did include that in your comments. But two of the metrics, deaths, the metrics related to deaths and cases, large jurisdictions like San Diego would never be able to meet those unless the pandemic was over. So that was an intentional strategy, and intentional because we don't want larger jurisdictions to open up too fast, and we are trying to meter looking at the public health benefit with the economical benefit or the economical focus of businesses reopening. But we cannot do that too quickly. Last week, Supervisor Fletcher shared with you what happened in 1819 when some jurisdictions did not follow suit and opened up too fast, and there was a second wave. And we do not want to have a second wave. So I understand that this is might be stressful for some, but if we all move in the same direction slowly, then we won't have to backstep and create restrictions again, so that we are sheltering in place or at home. And currently, I just want to remind people that we are still not gathering, and currently in stage 2, we are in the stay-at-home order, but other things are loosening up. So I just want to remind people of that.
So just to follow up, so the county is in the same frame of mind as the governor, or is there still a desire to modify some of that?
We're trying to strike a balance. We're trying to strike that balance, but we definitely do not want to open up more quickly than will cause an impact to the public's health.
Thank you. Thank you.
Okay, let's go to the next question.
Artie Ojeda with NBC7, please state your question.
Good afternoon, everybody. Several casinos plan to reopen next week. What immediate concerns do you have, since obviously groups of people are going to be gathered in a closed environment and most of their visitors live, across the country, across the county, county.
Okay, Dr. Wooten?
Thank you for that question. We are very concerned, and we want to make it perfectly clear that we do not agree with reopening of casinos on May 18th. We feel that the health officer's order does extend to our tribal nations in this particular situation, and we are working with the Centers for Disease Control and Prevention to try to address this issue further. Thank you.
If I could follow up, I mean, the casinos, like you mentioned, they're on tribal land. It's understood they're allowed to operate on their own timelines and terms. They say that they're going to go above and beyond CDC, state and local protocols. So to that end, how confident are you in the safety steps that the casinos say they're proactively taking?
Well, I have not personally seen their plan. But again, we do not agree with the reopening. I think I cannot be more clear than that, and we will work through CDC to determine if we can address the issue further to prevent the openings on May 18th.
Wow. So, Dr. Wooten, the county is going to take steps to try to prevent them from reopening?
We are working with the CDC, and we will talk with the casinos. Again, I don't have answers for the future, but that's what we are doing at this point in time. So that's what we're doing, and that's what we hope to do. And otherwise, we will want, if they do open and ignore our request not to open, then we would definitely have to ensure that they put stringent practices in place to help protect the public's health. But opening up casinos will cause a risk to our public's health. That is very clear. It creates gathering of individuals. So we'll just see what happens and see if there are any additional modifications that come out of the state. Thank you.
Thank you.
Okay, let's go to the next question.
Joshua Smith with the San Diego Union Tribune, please state your question.
Yeah, thanks for taking my question. As we have this conversation about how fast to open up the economy, Supervisor Jim Desmond suggested on a podcast, talk radio show, that we've only had 6 COVID deaths where there wasn't an underlying health issue. So he called these purely COVID-related deaths. Is there any reason to think that the deaths associated with COVID where there's a medical condition, an underlying medical condition, to be thought of differently than those without an underlying medical condition?
Respond.
Well, I want to thank you for that question, and there is no reason to look at them differently. Every flu season, we tell people if you have underlying medical conditions, you are at greater risk for complications, which includes death. The same premise prevails here. With COVID-19, if individuals have underlying medical conditions, if they are older, underlying medical conditions could include diabetes, asthma, chronic lung disease, hypertension, obesity, compromised immune systems, and many more underlying medical conditions. Those conditions, if someone does get COVID or contracts COVID-19, they are at greater risk for dying. And their life is no less valuable than someone's life who does not have underlying medical conditions. So this is not just San Diego. This is how this is done across the entire nation in terms of identifying who has died from COVID-19.
Thank you.
Dr. Wooten, I have a question from Alexis Rivas with NBC7. We've received records of 211 complaints for essential worker face mask violations. In just 1 week in April, 725 reports were filed about essential workers not wearing face masks. Are you concerned of the number of essential workers not obeying the county mandate? And is the county taking 211 complaints into consideration when making reopening decisions?
Of course, we are concerned. The county is concerned about people not following the health officer's order because face coverings not only helps the individual who is wearing the facial covering, but it helps other individuals that they come in contact with. So we will continue to promote this effort, and in terms of enforcement, each jurisdiction is required to conduct or implement enforcement in their respective jurisdictions. But of course, this is of concern, and we will continue to try to address it by disseminating facial covering to individuals, whether it's in the parks or in county locations where we have law enforcement circulating.
Dr. Wooten, I have a question from Gary Worth with the Union Tribune. Did a child who had the newly discovered mysterious symptoms related to COVID-19 die in San Ysidro?
So to date, in the disease of this that you are speaking of is called pediatric multisystem inflammatory syndrome. To date, we have not had a case of this syndrome associated with any of our COVID-19 deaths that we are aware of. Now, this condition actually can occur weeks, even up to 6 weeks after someone has their symptoms have resolved from COVID-19, but to date, we have not had a report of this syndrome.
And I have a question from Abby Alford with CBS 8. How long does COVID last after someone dies from COVID-19? What is the risk of exposure to those in contact with a deceased person from COVID-19? And is there any risk that is being done, such as PPE for funeral home for the people who are handling the deceased?
So CDC has clear guidelines related to handling of individuals that are deceased and been managed and handled by morticians. So that information and guidance is out there. Obviously, they should wear personal protective equipment. That is standard practice for our morticians. So that guidance is out there for morticians from the Centers for Disease Control and Prevention. And there was another part?
Just how long can you...
Yeah, actually, I'm not certain if it's known how long the virus can last in a body, but again, with the guidance from the Centers for Disease Control and Prevention, morticians are advised about how to handle bodies, and also family members are advised about their contact with bodies if individuals have died from COVID-19.
All right. Thank you, Dr. Wooten.
This next question deals with the governor's press conference today and his reference to the fire season and how that interacts with the whole COVID-19 pandemic. Supervisor Fletcher is going to respond.
Thank you. This one is from Kim Miller with ABC 10 News. Today, the governor addressed the upcoming fire season and the need to identify additional space to quarantine COVID-positive fire evacuees should wildfires break out this season. Has the county begun to address the potential problem?
Thank you, Kim. The county has, from the very onset of coronavirus, our Office of Emergency Services continually develops contingency plans for how, in the current environment we're in, we would respond to a multitude of other emergencies, whether that be a wildfire, which we're very familiar with here in San Diego, or an earthquake, or anything else. And so they do plan for that. The things the governor mentioned today in his press conference are things that our team here at OES has been taking into account and preparing contingencies for, and we feel we are well prepared should we need to deal with two disasters at the same time.
And Supervisor Fletcher, I have a question from Mike McKinnon with KUSI. Since our lockdown order has no deadline, does that mean we are expecting to follow Los Angeles County's lead and have limited reopening through August?
No, it doesn't mean that at all. Our orders are aligned with the state of California, and as we have been proceeding consistent with the state of California on reopening, we will proceed consistent with the state of California on the stay-at-home orders as well.
And thank you. I have another one. This one is from Rachel, and the question is there any indication when the rules will be loosened at the beaches, specifically the ability to sit down? Obviously, the beach is not an option for families with babies or toddlers under the current restrictions, so is this part of Phase 3, and any information on that would be appreciated.
Well, Rachel, we want to lift every restriction that's in place and get everything back to normal as soon as possible. The challenge is because we can't predict what the future will yield in terms of cases and hospitalizations and curves. We can't predict what the future will yield in terms of when we will get to each of those things. We have taken some steps forward as it relates to beaches, primarily designed to provide recreational opportunity. We've talked about getting outside and exercising being an important part of that. We've been in a position to provide greater flexibility in our parks because we don't get as much of a problem of overcrowding at parks as we get at beaches. And we will continue to work through making every loosening or easing as soon as we possibly can. Again, understanding there's often a delay between an action we take and when we see the impact of that. And so, we want to continue to work through these phases patiently and responsibly to ensure a smooth recovery. So we don't know exactly when that will be, but hopefully soon.
Thank you, Doc. Thank you. Supervisor Fletcher.
This next question deals with underlying conditions and some of the deaths that have occurred attributed to COVID-19, and Dr. Wooten will respond.
And this one is from Carl Cicchetto from News 8. Could someone please explain underlying conditions in regard to deaths? What percentage of the general population has underlying conditions?
So that's two questions. I will address the first question about the general population. Our general population, and actually you can find this information on our county's website, Community Health Statistics, over 50% of the general population has at least one, and that might even be as high as 75%. And I've already given you the outline of what underlying medical conditions are, and I will repeat those again. First, it includes heart disease, it could be diabetes, chronic lung disease such as asthma and chronic obstructive pulmonary disease or COPD. It could be cancer or people who are getting cancer treatment, individuals with compromised immune systems, which would be caused by the latter situation, as well as individuals with neurological conditions or HIV and AIDS. So any medical condition that decreases or compromises the immune system or chronic disease. Obesity would be a chronic disease. And so all of those are underlying medical conditions. And again, well over 50% of our population has at least one type of underlying medical condition. Hypertension alone is an underlying medical condition, and a large number of our population, again, over 50% of individuals have hypertension. So again, for the general public, and all of those types of chronic diseases. That information is found on our Community Health Statistics website. Overall, comparing it with the state, for the county, and by our regions, as well as neighborhoods and municipalities within each of our 6 HHSA operational areas.
Thank you, Dr. Wooten. If you can bear with me, I've got a couple more. This one from Mark Ziegler with the UT. We have a story saying that the San Diego Loyal, a minor league pro soccer team, is conducting workouts with 4 players. Is that permissible, and can youth and college teams do the same without explicit permission from the county?
So again, stage 2 does not allow gatherings. So when you have individuals that are coming together that are not household members, by definition, that is gatherings. So when sports teams talk about we're going to start playing again, there really has to be a plan in place for them. How are they going to deal with individuals that come down with symptoms? Or how are they even going to prevent individuals gathering together in terms of checking symptoms, their temperature? So there's a lot to be considered here. And again, gatherings are gatherings. If people are coming together and they are not household members, that is considered a gathering, and individuals should be concerned that people might be coming to the table, coming to these gatherings. If they have symptoms, then others are put at risk.
And I have another question from Guillermo Mendez from Univision. Has San Diego County seen any positive COVID-19 cases linked to the Kawasaki disease? And if so, do you know how many?
So that's the same thing as the pediatric multi-system inflammatory syndrome, and the answer is no. We have not, to date, had any such cases reported to. Dr. McDonald is here, and he can also add some additional content.
Sure. If I can address the Kawasaki disease question specifically, you might remember that actually last year at this time we actually had a relative increase in the number of Kawasaki disease patients that were being seen in San Diego, and we actually put 2 health alerts out on that at the time. It was unclear as what that was related to. Kawasaki's disease is thought to have a number of potential triggers, and the true underlying causes of Kawasaki's are not clear. There is a center of excellence here at Rady Children's Hospital in San Diego that cares for many of these patients in Southern California, and we've been in close contact with them since this possible connection between Kawasaki disease and pediatric inflammatory multisystem disease was identified across the country. Again, we've not seen specifically any cases of PIMS, or that inflammatory disease. And actually the number of Kawasaki disease cases that have presented here in San Diego so far this year is lower than last year. But we're following this very carefully with our local experts on Kawasaki disease and our local pediatric intensive care physicians to see if any of these cases do occur. And I did want to follow up one question. There was a couple questions specifically on the underlying medical conditions. And for the underlying medical conditions, the most common underlying medical condition that was identified in the deaths in San Diego is hypertension. Actually, 54% of our cases have hypertension as an underlying condition. 36% have dementia or Alzheimer's. 31% had diabetes. 30% had cardiac disease. 20% had chronic kidney disease, 11% had COPD or asthma, 9% were immune compromised. Actually, 7% of the patients, the only underlying condition that they had was hypertension, and 6% had obesity. And if you add those percents up, that's way more than 100%, meaning that obviously some people had more than one condition. These percentages of the breakdowns of the relationships between underlying medical conditions and deaths in San Diego are actually very similar to what's being seen across the country. So I would refer you to CDC's website, which actually has some detailed information about people who have had severe outcomes from COVID and the underlying medical conditions. And again, across the country, the #1 condition is hypertension.
This last question we have today deals with testing, and we're going to call up Nick Mascione, our Director of the Health and Human Services Agency, and our testing czar, to respond to that question.
Yes, this question is from John Carroll from KPBS. This morning, Mayor Sotelo Solis of National City called on more support from the county to increase testing. Will the county provide that, and if so, how?
Through the great leadership of the National City Mayor, Alejandra Sotelo Solis, we're actually working with Paradise Valley Hospital. So today she announced how the County of San Diego gave a Abbott rapid test to the hospital, the ability to do tests right there at the hospital, which they did not have the capability as part of expanding our testing in National City. We're also working with the San Ysidro Health Center in working in concert with our county and the city in their food giveaway programs and aligning that with expanding testing in National City, looking also at our Live Well Center in National City, expanding testing. And this fits in as part of the broader South Bay saturation testing strategy we're pursuing and working with Imperial Beach and Chula Vista and areas in San Ysidro.
Thank you, Nick.
Well, thank you. That concludes our questions for today. But as we have done from time to time, let's give a shout out to people doing good things in our community. Today I wanted to talk a little bit about two Carmel Valley Middle School students who raised money to purchase surgical masks for medical, public safety, and social service agencies. According to the San Diego Union, Ruby Gao and Catherine G., both 13, donated 5,000 masks to, among others, the Alvarado Hospital, the Salvation Army, our own San Diego County Sheriff's Department, and the San Diego Police Department. They called their project Project Butterfly, a play on the butterfly theory that small actions can lead to big results. It's up to each of us. Our individual efforts can make a huge difference, like Ruby and Catherine. So let's all keep working together to make a difference. Have a good day, and remember, stay in place, maintain your space, and cover your face. Thank you. We'll see you tomorrow at 2:30.